eating my dinner here, so sorry about that. If I take one more bite, that's all that's left. So good to see so many familiar names and faces. Hello, everybody. Lawrence, my chocolate pudding buddy, how you
How are
doing?
you? Good to see you. I should have brought some to eat with you on the call.
That would have been really funny. But instead I'm having basil chicken,
Oh, that's much healthier.
pesto, and sun-dried tomatoes. Yum. Okay. So we're going to get started here in just a minute. Just want to make sure everybody's all connected. And could the guests with phone number 518461 just unmute yourself and identify yourself? And would 1631 please identify yourself?
Can you hear me?
I can hear you.
Can you? It's June Costello.
Oh, hi, June.
Hi, June.
Okay, great. Just want to make sure we know who everybody is. And thank you, June.
Yes.
You can go back on mute for now. But you will want to keep that mute and unmute button ready to go because this is going to be a conversation today. And would
6-1, I believe.
631, who's that? 631-522-5025.
You know what that might be? Let me check it. Just seeing. Oh, no, it's not on this listing.
Okay, if that person does not identify themselves, I'm sorry, but we're going to have to remove you from the room. So we need to know who 631-522-0525 is. Please unmute yourself and identify yourself, or you can't play anymore.
Give me 1 second, Lisa. I'm just looking that up too.
Okay.
To see if it's who I think it might be.
Okay, while we identify the mysterious 631 who probably can't find the unmute button on their phone, and I'm so sorry for that, but I do need to identify you.
But I think you have to press *61 to unmute yourself.
631, you've come into
he may not, he or she may not know that.
Yeah,
I think it's didn't.
star.
Okay,
I think it's *61.
631, you can speak now. Say hello.
Sorry, you said *61?
Yes, that's Jassim, right?
Yeah.
Hi.
You listen me?
Okay.
We can hear you now.
Okay.
All right. Well, welcome
Mystery
everybody.
solved.
With mystery solved, now we know who everybody is. This is going to be a participation event this evening. And I'm sorry I look like something the cat dragged in, but I'm tired. It's been a busy couple of weeks, so we're not really camera ready tonight. Just deal with me. Okay. So tonight we're going to do something a little bit different. This is part of a research protocol being conducted by some of our friends over at NYU and some others. This video will be reviewed by research staff, and your answers will be used in the collection of, hold on, got somebody else joining. Your input will be used to gain better perspective on the area of research. I'm going to do some boring stuff, and I'm going to read directly from the study design so you understand exactly what it is that we are studying and why your feedback, your honest, raw, lived experience feedback is critically important to helping us make the future of diagnosing HCM and aligning with care and figuring out how to use it all and put it all together. Your feedback is going to help us design things for the future and give us better insight into where corrective action can be taken within a healthcare system. So there's a couple of different branches to this study. So what I'm going to read you, you're going to be like, how does this and why do you need to hear from me? But hear me out and it'll make sense. And before I start this, my co-host tonight, Linda Montgomery.
Hi, everybody. It's so nice to see your faces with your names now. I think I've talked to just about every one of you, but haven't actually seen you in person. So nice to meet you.
Linda and I are going to be running this, we're going to be tag teaming on each other tonight. I'm going to take the first part and she's going to take the second, and I'm going to go off camera for a bit at the end, and any other feedback that you want to give without me here, you can do that too. Okay. The goal of the study is to, number one, identify clinicians and system level targets for intervention that can provide clinical evaluation and decision-making related to HCM. So that's one of the aims of the study. Hold on one second. Hey guys, can you keep it down? I'm in a meeting. Nice to see you back, but sorry about that. And two, develop pathways to address system level gaps in HCM evaluations, referrals, and treatments. The project will be using a mixed method design to achieve its purpose. Number one, it will qualitatively examine clinical level factors that influence provider assessment via structural interviews. And two, will examine system level barriers and facilitators to HCM assessment through electronic medical record analysis. So they're going to be looking at the workflow behind the scenes to see how some of these interactions are happening in the system. And then we're going to be talking about the lived experience of how well did that really work, or how well did it not work? And when did you intervene within? What could we do to make it a little bit better? So the goal of today's focus group is to include the patient voice, shout out for the patient voice, into a qualitative assessment of clinical level factors that impact referrals of patients with HCM to specialty care. Ultimately, the topics discussed during the focus group will inform the questions that will be used to interview primary care and general cardiology clinicians about their referral practices. So your lived experiences are going to help shape how we're going to talk to clinicians and GPs about their real behavior, not the behavior that they claim to be doing, but the things that you actually lived and experienced. For example, maybe you live in an area that's going to require a plane, train, or a long automobile drive to get to a high volume center. Did your clinician talk to you about how that was going to work for you, or could you do that? Or did they just assume that you couldn't, or just assume that you can and it's not a problem and you wouldn't need some help facilitating how to do that? So that's one of the barriers. The other could be that your doctor told you that you didn't really need it because your HCM wasn't that big of a deal and don't worry about it. Is that the barrier? Was there a knowledge barrier? So we're going to talk about some of these interactions that you've had with the system, and we're going to collect your thoughts. Everything here is on the table. You can say anything. Don't say anything disparaging about a particular doctor. If they were an idiot, just call them an idiot and we can move on with the idiot. Because we know not every interaction with every healthcare provider has probably been positive in your experience. So feel free to just use whatever language you're comfortable with. There is no grammar police here. Whatever you're comfortable sharing, just your gut instincts on how you feel about things. And we're going to talk not only about problems, but potential solutions, or what could have been, or what would you like to see the next person diagnosed be able to experience. Okay, hold on. What are you doing? Why are you jumping up here?
So just one comment too to all of that. Remember, as I think I told you guys when I sent you some information about this, that we're talking about your journey to diagnosis, right? And then the different levels that you may or may not have had to stop in. That's the context of what we're doing here. And then, like Lisa said, try to remember we're talking mainly about your primary physician, not your HCM specialist. Okay.
So it's the path from primary to specialist and back again, and up again and back again. So we know it kind of ping pongs for some of you. So I'm going to try, and I'm making sure my two phone people, when we go around, because I'm gonna have people do show of hands, and you can physically just hold up your hands because I can see you all. You don't have to use the emojis on the bottom. If you want to give me a thumbs down or a thumbs up on certain things, you can do that. June, and I'm sorry, I forget who else is on the phone.
Jasim?
Jasim, sorry.
Yeah.
Yep.
When we come to any kind of votes, I will just ask for you guys to chime in. I'll call you out, and Linda will do the same as we're trying to collect information. Okay, so if at any time you have any questions that you need clarified, just ask me and we can do so. Patricia, I don't know why you're sharing the screen, but I just went into infinity and it
I'm
really is a
sorry,
bad hair
me
day.
too.
I'm having a problem here. I shrunk you. I'm sorry.
It's okay. I'm going to stop the participation. That
Okay.
was funny. I'm just in this little square and I just
Yeah, and
went
for
into
her
infinity.
second trick, what are you gonna do?
It's very
Okay.
1980s, like video.
All righty.
Yeah.
So let's begin the work. When you think of your journey to an HCM diagnosis and then to treatment, how many providers, layers of the healthcare system did you have to navigate? I'm going to do this one by show of hands. How many of you first tried to communicate with a general practice physician about the symptoms that you were feeling or the indications that you had that led you to look for HCM? How many of you met with your GP? So by hands, let me just do a count. 1, 2, 3, 4, 5, 6. And then we have June. Did you meet with a GP?
Uh-oh. Where'd she
We
go?
Here,
Can you hear me
June.
now, or do
Oh,
I
now
need?
we can.
I can hear you now.
Okay.
Did you
Um,
meet with a GP?
I did, but that was not where I was diagnosed.
Okay, but
Yeah.
I'm trying to figure out how many layers. So we have the GP as layer 1,
Yep.
and phone call number 2, Jasim. Did you meet with your GP to discuss your HCM related symptoms?
No, unfortunately, my GP did not diagnose that. So basically, my diagnosis was made, I would say, at a third level, not even my
Okay.
general cardiologist did it.
Okay, so your GP, did you refer any of your symptoms? Did you talk about any of your risk factors with your general practitioner at any time before your diagnosis? A
I
yes
did
or a
not had
no?
any symptoms.
You didn't have any. Okay, so
I
that
did
would
not
be a
had
no.
any symptoms, so I didn't discuss.
Okay, so in that question, 7 out of 9 met with a GP. How many of you had a community cardiologist evaluate you? Show of hands. Okay, so we're down to 1, 2, 3, 4, 5, 6. Okay, 6 of you have been to a community cardiologist. June, did you go to a community cardiologist as well?
What's the difference? Is there a difference?
I did. And I wouldn't say she diagnosed me either. She gave me she said something else was wrong. It wasn't until I pressed further, had some other testing, and then just kept pushing. So I would say, yes, I went to a community cardiologist, but that's not where I was diagnosed.
Okay, so you went through 2 layers of care in the healthcare system. During that level of cardiology care, at that interval, did any of you work with nurses in the cardiologist's office? Did you try to titrate medicine in the doctor's office at that level? Or did you find your way to a center of excellence for care? So did anybody have any disease management done at the cardiologist's office? 1,
Testing.
2, testing.
Yes.
So you had some testing, 3, 4. So some of you had some testing at the local cardiologist. Some of you didn't. Some of you, now this is where we're going to go for audibles. I'm going to start with Polly, and then I'm going to go Mimi, Lawrence, and LP next. The question is going to be, how did you get to the highest level of care that you're at? And if you could define if you're at a HCMA recognized center of excellence or another high volume program for HCM, let us know like where you're getting your care and how you got there. How did you get from, there's something wrong with my heart, it's this thing called HCM. How did you get to your highest level of care? Polly, unmute yourself.
Hmm.
That helps.
Okay.
Hello.
So I think my story is a little bit unusual because I started out at a COE. Okay. And the reason for that is that we have family HCM. I was examined by Dr. Sherrod over 20 years ago. And, and I had nothing wrong with me. But at that time, there was no recommendation to be retested every few years.
Okay, hold on one second. Did you get your coasters that I brought you from Sweden that are on the table out there and the chocolate bar?
Any coasters in
Yes, go get them on the table. Ask your father where they are.
coasters in Sweden?
They have dollar horses on them. Sorry. I don't see her very often anymore. So you got to the center because you have a family history and you were clear. And how long did it take you? Did you go back to that center?
What happened is that 22 years later,
Oh,
I myself walked into the center because I felt so terrible that I felt I had to see them. I had had a hypertensive crisis, but my internist, every single doctor that I spoke to from the time I was 40 until I was 62, I told them about my family history, but I also told them that I was cleared when I was 40. So they had the expectation, I guess, that I didn't have HCM, and none of them knew that I had to be retested periodically.
your first testing occurred in what year?
When I was 20, so when I was 40, sorry, when I was 40 years old. So I was born in 57, so that's 97.
And that was a lot of math. Okay. So 97 was your first screening, and then you were diagnosed in 2017?
No, later than that. It's
Wow.
yeah, maybe. I'm sorry. My math is worse than yours. I had my surgery in 2020, so I was diagnosed in 2018 or 2019.
Okay.
I was diagnosed in 2019 because I had my surgery 6 months later or less.
What would have helped bridge your diagnosis?
So again, I had cardiac symptoms. And for example, I ended up in a urgent care center once because of cardiac symptoms. I told them my family history. That was a very good hospital. They didn't suggest that I needed to go back and have anybody look at my heart. I mean, this kind of thing happened to me several times where basically they said, oh, you've been to a good doctor. They said that you don't have this, and therefore nobody seemed to know that I needed to be retested. The year before I was diagnosed, my brother dropped dead. So I called and I actually spoke to Dr. Sherrod himself, sort of reminding him that I existed in that sense. I mean, we spoke, we had a nice conversation, but I wanted to tell him that my brother had died because he died unattended. And so there was nothing. I had hypertension. And I said to my internist, you know, the only people in my family who had hypertension were my father and brother. They both had HCM. But I was cleared when I was 40. But my doctor didn't know enough to know that that didn't mean that I didn't have HCM. Just because my heart was okay when I was 40. The fact that didn't mean that it was still okay when I was 60. So
Good.
I think that for me personally, my experience is that none of the doctors, and I changed internists a number of times during this time, None of my doctors suggested I go back. Dr. Sherrod didn't say to me, have you ever been retested? Okay. So, when this all happened, I was actually pretty upset for a while. I've kind of gotten over it, but, I was quite sick.
Well, the interesting thing is, and I'm putting this kind of on the record because these are moments of education. These are teachable moments, right? That's what this is all about tonight, is teachable moments. Back in the 90s, there was a pretty strong belief that if you were screened clear in midlife, that the likelihood it would develop later was so small, it wasn't even worth looking for. And then maybe about 5 years after that, they're like, no, 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 it can show up anytime. And even recently, they were going to be pulling back the guidelines that if you didn't appear by 50, there was no need to continue to screen you. And then the doctors who were fighting for that, somebody popped into their clinic and they saw somebody at 58 for the first time showing up after a series of screenings. So we can't let our guard down with HCM once we know it's in a family. The likelihood that it will show up in another member is so high. We must act and we must educate physicians on that very important issue. And we're still evolving in our knowledge, which is why we're holding a focus group. So, Polly, thank you for that input. I'm going to go to Mimi and ask about your diagnosis story and the highest level of care you've gotten. Hit that little mute button.
Yes.
There she is.
Hi. So, it actually, the first time I went and complained to a GP about symptoms was in 2011. And I was sent to a cardiologist and they did an echocardiogram and they said that I was fine. And so then I just didn't think of it again. And then 11 years after that, when I was 57, I went to the dentist, and the dentist, you guys remember this story. The dentist told
I
me
do.
that I had a really low heart rate and that I should mention it to my primary care provider. And she reminded me, like, as I was on my way out, she was like, don't forget, tell your primary care person about your low heart rate, And so I had an appointment a few weeks later and I mentioned it and I said, oh, the dentist said I should tell you. And she said, well, that might be nothing. A lot of people just have a low heart rate. But have you been having any symptoms that might suggest something's wrong with your heart? And I was like, no, what do you mean? What symptoms? And she was like, well, have you been short of breath? Have you had palpitations? Have you had dizziness? And I was like, well, yeah.
Doesn't everybody?
Oh, that.
Right,
Yeah.
exactly. So I remember that she said, like, well, it's sort of borderline, but I'm just going to refer you to a cardiologist anyhow. So I went to a cardiologist at Mount Sinai, and she was a fellow, like on some kind of fellowship. And so she um, did an echocardiogram and she told me that, just because of the septal thickness, that she suspected that I might have HCM, but that I didn't have any kind of, gradient. And she said, we're going to have to get you approved to have another echocardiogram where we take your gradient when it's provoked. And then a gradient did show up. Oh, and I should say, I had forgotten about the first cardiologist entirely. But
Oh.
after she told me, I just, after I started going through all this, I thought, like, I think I had one of these tests before. Why did I have this test, And then I actually found a summary of my old echocardiogram. And it said that I had a sigmoid shaped septum with basal hypertrophy. It just wasn't measured at 1.5 centimeters. It was like 1.2 or something like that. So, you
And this
know,
was 2011.
yeah,
And how tall are you, just out of curiosity?
I'm 5'4".
And you're a small build.
Yeah.
So
Mhm.
a small framed woman, diagnostic criteria today, some would argue is not 1.5, it's closer to 1.3.
Yeah. Well, I
So
wasn't
what
quite
are you aware?
there, you
No,
know.
you weren't there. You were, but had we measured you more carefully, maybe, who knows?
I mean, they did say that I had basal hypertrophy and all of that, you know.
Mm,
So I
If
don't
you have,
know.
yeah, if you have the asymmetric presentation, that could have been a trigger. Again, learning moments here that I'm just trying to
Right.
like document. And
Right.
your care, where have you gone anywhere other than Sinai, or is that where you leave your care now?
Yes. They found a provoked gradient, and the cardiologist there said that she was gonna refer me to someone at Mount Sinai who was a specialist. And then I did some looking around on my own, and I found NYU. So I told the cardiologist, I think that I want to make an appointment at NYU. And then she wrote down Dr. Sherrod's name and gave it to me. But so it was
To
kind
the
of my
team
own
this
idea.
evening. Okay.
Yeah. So it was kind of my
There
own
you are.
idea, you know, and then I made an appointment, and my appointment was with Dr. Macera, and that's when I began care at NYU. So that's my story.
Okay. Thank you. Lawrence, tell us about how you got to that diagnosis.
Sure. So February of 2020, I went to a routine doctor appointment with my weight loss doctor. I had lost about 80 pounds over the course of about 10 years, starting back in about 2014. And I'm going to come back to that in a minute because I had no symptoms prior to that, but I have asthma and I have a couple other warnings, possible warning signs. Through the routine exam that the doctor does at going to these appointments, she was like, "Let me check your heart rate, your blood pressure and your heart rate and everything. Listen to my lungs." And she said, "I'm hearing a murmur. I'm going to refer you to a cardiologist." I was like, "Okay, that's interesting." So the only other time I had a murmur prior to that was one time when I was in college, and nothing ever came of it. We couldn't get it again. So, but my mom has a murmur, so there's a couple of parallels there. And my brother gets them sometimes. So flash forward, the weight loss doctor referred me to William Cole at NYU. And this was right at the beginning of COVID. So a lot of my interaction with Dr. Cole was virtual. And so he recommended a MRI, a CAT scan, and a Zio patch. And that was in May, so a couple months later. I also had an echocardiogram done by my weight loss doctor. When all those results came back, Dr. Cole said, "You have hypertrophic cardiomyopathy that's obstructed." I never heard of that term before. I was like, "Okay, what's that?" But he referred me to Dr. Macera. And that was in July of that year. And I saw Mila, who's still on the staff, but isn't a nurse practitioner in the daily practice. Great onboarding, had a fantastic, they explained everything, and I did genetic testing, and they weren't able to identify at that time a specific gene, and explained that whole process to me. I'm still with a patient of Dr. Macera's, but looking back about a year or so ago, I found my old records from a previous cardiologist, and that was when I was 37 at the beginning of my weight loss journey, right before I got referred to NYU for their weight loss center. And I did a stress exercise test with them, and it said that I had a thick septum, and I was 37 at that point. And I had gotten diagnosed officially at 45.
Mm.
So it's kind of interesting. Yeah, and so,
Wow.
and then
Okay.
I got COVID about 2 years ago, and I was fine. I was symptom free. It was like, "Hey, see you once a year." when I got COVID for the first time, that's when my symptoms kind of kicked in. And I had to see Dr. Macera's team much more regularly. And that's coming out of COVID and everything. That's when I was put on Camzyos. About a year after Camzyos came out, that's when I was put on it. And things kind of have gotten a little more difficult over that time. But I see them every 90 days now.
So in terms of the communication, you had a complete break because your wall measurements met diagnostic criteria. How many years before you were originally diagnosed?
I saw that I had a thick septum at age 37 and then officially diagnosed at 45. So
8 years.
8 years.
8 years. Yeah. Now we have 2 of you with clinical signs well ahead of your diagnosis that did not trigger any additional surveillance.
And that cardiologist was
Interesting.
that cardiologist was a general cardiologist, not NYU. And I don't think that they just said, hey, you have a thick septum, we just have to monitor this. I don't think that they had the wherewithal to say, go see another cardiologist. It's HCM or something. Whereas Dr. Cole was like, this is HCM, we got to get you to Dr. Macera. It's kind of interesting.
Okay. That is interesting. Okay, we're gonna go LP, Chris, Patricia S, and then Patricia B, and then we'll go to the phones. Okay, Lawrence, thank you. LP, unmute, you're up. It's hard on those phones. There's a little button at the bottom. I always get it lost. Uh-oh. There you is.
Still muted though.
I wish they would just let me unmute you.
Okay,
There you go.
I got it.
There you go.
Oh, it's so confusing. I'm on my iPad. I'm not on my phone.
Oh, okay.
So I had my brother and my sister were both diagnosed. So they were diagnosed younger. So I had been being followed for a while. I didn't have the condition, but I would get chest pains every now and then. And so I was screened regularly. And I think maybe the last couple of years before I was diagnosed, they said they heard a slight murmur. But nothing to be concerned about. They were just kind of watching me. And then 2023, I was having a lot of shortness of breath. My heart rate was up. I ended up going to the hospital. And they told me I went to my doctor first and she did a chest x-ray, told me I had pneumonia, which then I went for a CT and I did have some stuff in my lungs going on. So I didn't really know. I didn't really think it was my heart. But then I was at work one day, got really struggling to breathe. And not knowing I had anything wrong with my heart, I did my albuterol a couple times, which I think shot my heart rate up. And then I went to the hospital because I didn't know what was going on. My heart was beating super fast. And my chest was heavy and I couldn't breathe. And then they actually did that, whatever testing they did. I know they did an EKG and stuff and still didn't think it was my heart at the hospital. But said, given your family history, and your murmur, you should go, have, some more testing done. So I did. And, they came back. This was the local cardiologist that said I had HCM. And he just was going to write me a script for metoprolol and send me on my way, I think, but I was super nervous. I was still really struggling to breathe at the time. So I asked him if I could go to Cleveland Clinic because my sister and my brother both go there. And so he did write me a script to go to Cleveland Clinic. where I see Dr. Desai there now. And I was put on Camzyos.
Okay. And how old were you when you had the episode where you used the inhaler?
I was 48.
Okay. And have you had your asthma assessed additionally after your diagnosis of HCM?
Yeah, I actually, I don't know. I felt it's hard with me too, because I don't know what's my heart and what's my lungs. Because I'm still struggling. I felt like after I started the Camzyos, I felt like I felt better. And then just recently, I'm starting to get more short of breath again. And so I just went to see my pulmonologist and did a breathing test. So or the pulmonary function test. So I haven't, he hasn't discussed those results with me yet, but I know from the CAT scan that I do have some scarring in my lungs. So I don't know what's HCM, what's asthma, what if I even have asthma or if it's scarring in my lungs. But from talking with my cardiologist, they don't think that my shortness of breath is due to the HCM, given my my echoes, because those have been pretty good. So they seem to think it's my lungs.
An interesting observation from my point of view on that one is the specialist who doesn't have any good new things to give you for the thing will tell you it's the other specialist's problem. And they'll go back and forth on it a lot. Even in HCM, sometimes people without obstruction have a lot of shortness of breath. And it's starting, leans more into the diastolic dysfunction. And we are given best hypothesis rather than facts sometimes because we don't really know all of the answers yet. So I hope you get to some clarity on that. It's an interesting path that we got a good mix of different kinds of paths that people got led through here. So that's great. Thank you for sharing. We'll move on
The other
to
thing too is, can I just mention, and I don't know,
please.
I think it's kind of interesting, is that when I did the gene testing,
Yeah.
Since all this happened to me, a lot more of my family members started going and getting tested for the gene. My brother, my sister, my father, my uncle, a couple of cousins, and some of their kids all tested positive for the same gene. My testing came back, I think it was unspecified. So I'm not sure why they all have the same gene and I came back unspecified.
Did you have the same lab do the test?
I don't know.
And what was the time gap between the tests? If you want to send them over to me and we can talk it offline, we can take that. There could be some answers for that actually aren't as cryptic as you think. Certain labs define mutations certain ways, but when you put them into a family, they change meaning to a certain degree. So it could be just a different lab and a different panel and a different time and a different writer. So happy to go over that with you offline.
Okay.
Okay. Anything else before we move on to Chris?
Nope.
All right. Thank you. Chris, Mr. T, you're up.
Yes. I should begin by saying I'm adopted, so I have no family history. I don't have children. There was no need for me to do genetic testing. So as Lisa knows, I'm extremely fastidious about all things medical. I played hockey at a very high level through high school, college, and past. And one day in 2009, I felt a little fluttering. I decided that I was going to go check it out. I've been to doctors before. I've heard words like your heart is thick, it's big. Nobody really had any concrete evidence to what it was. And
What year are we talking about here, Chris?
I'm sorry?
2009? Is this
2009, I felt the fluttering. It was after a day I had maybe 3 hockey games in a row.
okay. And the murmur was first heard and your thick heart. When did they tell you those things?
I would say back in 2000, could have been earlier.
Okay.
So at that time I was about 40. And I went to the doctor, I did the testing, I did a stress test and I did an echo. And I was told by two nurses that everything was fine. A year later, I was sitting down and I said to that time my wife, I think I should get my medical records in order. I called up the same doctor who happened to be a cardiologist as well. And I said, I'd like to get that information. She said, could you do me a favor and hold on? And he came to the phone, which you never could get him on the phone. And he said, listen, I saw a run of tachycardia. And I said, Dr. Smith, I'll just change the name. That was a year ago. And he said, well, then it was my mistake. I'm sorry. So I was a little strange by that. So I said, okay. I decided to contact St. Francis Hospital, which is a hospital in Long Island that's very well known for heart. I saw one of the chiefs there. He took the information and he started getting very aggravated when he was reading it. He said, this was plain and simple. It should have been noticed. And I was sitting in the room and I was happy that he knew what it was, but he decided to put me in for an EP study that day.
Oh, God.
Not going home. I said, okay. I went in, my wife came in, and I just remember the shock of my life when he triggered this fatal arrhythmia, as he called it. And he said, yeah, you're not going to go home. You're going to get a ICD put in because you have hypertrophic cardiomyopathy. At that time, what I did was I did some research. I came across Lisa and I contacted her. I also saw Dr. Sherrod in the city. He was a very nice gentleman. But since then, I moved on to another center of excellence where I've been. I've had some issues since, maybe some fluttering once in a while. I had it checked out recently. I believe me, my test records are, the size of a couple of volumes of encyclopedia. So I try to keep on it. But I think my biggest reason here, and I know you didn't ask me about this, is really trying to come to terms with living my life and not being totally cumbered by my diagnosis. And that's been a real issue. So it's back when I was 41, I was diagnosed, and I'm still being treated now.
Yes, thank you so much. Patricia.
Hi.
Hey. Two
Um,
Patricias in a row.
I know.
Yes.
I guess back in my early 20s or my 20s, I was diagnosed with a heart murmur, but no one ever said anything about it. It was just like, oh, you have a murmur. And that was kind of it. And I never really went to the doctor back then, except like my annual GYN visits, and nothing ever came of it. And when I got to my late 40s, I had symptoms, I guess, but I didn't realize because I was heavier then. So I was blaming all that on my weight and stuff, which had something to contribute to it. It was part of it. But I had a friend who was getting married. I was in the bridal party and I was like, you know what? I'm going to go to the gym. I'm going to get in shape. Well, I went to the gym and started with the trainer and he was like, you have high blood pressure. And I'm like, no one's ever told me that. He's like, well, before we continue, I need clearance from a doctor. So I really didn't have a GP because I've never never really needed one. Or I didn't think I did. Found this doctor, went to see her. She said, you have a heart murmur. I said, I know, people have told me that, but nobody's ever said anything about it to pursue it or do anything. And she said, I think you should see a cardiologist. So she referred me to a cardiologist out on the island. And he's the one who diagnosed and said, you have HCM, prescribed metoprolol and had me on metoprolol. But and then at one point he tried, what was that medication? I can't remember.
Pyramide?
No. It used to be not hard, difficult to get, but they would run out of it. I remember.
Oh.
I was on
Norpace
the
DR.
extended release, and they'd always, Norpace, right.
Norpace.
That was
This
really
year.
great.
I'm about to take mine.
But then he took me off of that for some reason. I don't remember why, but I just wasn't connecting with him. I had seen him actually for quite a few years, and I was found the HCMA, and saw that you had your centers of excellence and stuff. And he would just tell me different things. How he would follow Dr. Marin, but then I would ask him questions and didn't really have an answer. And I found out he only had one other HCM patient that he was treating. And So I was like, yeah,
Bye-bye.
so that's when I made my appointment with Dr. Sherrod. It was, I could tell you, December of 2015. And I had been asking this doctor out here about having surgery. And what he had said, he said, you don't want surgery. Once you have surgery, you're never the same. Yeah. And, so I was like, well, so I went to see Dr. Sherrod, and I had a follow-up with him like 3 months later. And at my second visit, he's like, you need surgery. He says, we need to schedule it, kind of soon as sometime this year. So in September of 2016, that's when I had my septal myectomy.
In terms of the communications between the community cardiologist and your chosen center, you were the driver in that relationship.
Mm-hmm.
How was the communication between the center and your clinician? Who provided the information back and forth? Did anybody?
No, nobody. Actually, I mean, I probably didn't handle it well because I wasn't sure. I didn't want to tell him I didn't want to see him anymore, the community doctor. So I just made an appointment with Dr. Sherrod and canceled my appointment with him. And when they called to reschedule, I said, I have a different doctor now. And that was it.
So you fired the doctor.
Yes, I don't know.
She broke up with her doctor.
You broke up with them. You had a parting of
We're on a
ways.
very big break.
You're on a big break. Okay. That's got it. All right. Anything else for the story?
No, I mean, I guess I don't know if he I'm the only one in my family with it. I mean, I don't really know about my parents. My dad, which my GP suspected he may have had it, but no one else in his family has it. But he passed away in 1972 from a pulmonary thrombosis. And she said it could have been, HCM could have been the cause or somehow related to it. My mom's had issues with AFib. She has a sister who has issues with AFib. I have a cousin who has issues with AFib. My brother has AFib. But I mean, no one, my brothers have been tested. There was no gene at all. They were able to identify the gene from me. My cousins, my grandparents, nobody. I'm the only one.
Okay, so you have attempted that family communication. We're going to talk about that in a minute too.
Yes.
But so you've attempted the family communication, but haven't found anybody else yet.
No, but it was also kind of weird. I don't know. People were just more interested in what because I had issues when I had my surgery, like complications. They were more interested in that story than the story that, hey guys, this could be you. Like they were like, yeah, no.
We all feel, no. Okay. All right. That will wrap up Patricia number 1. Off to Patricia number 2. And then we're going to go over to the phones and we'll do ladies first in the phones.
So that's
Okay.
me. Ready?
Patricia, you're on mute.
Okay. I'm
No,
still
she's-
on mute?
No, she's not.
The other Patricia.
Am I still on? I'm hearing an echo.
You have both of your computers open, so you could do not have audio on the one.
I only have
They're
one
conflicting.
computer. I don't
They're
know.
conflicting. You're
I-
hearing an echo because it's hearing both of yours somehow.
I don't have another one on.
She's on the phone and a laptop,
No,
phone and a
no, I'm
iPad.
not.
No.
Yes, you are. You're somehow logged in twice. And
Maybe
your
I'm,
audio is coming. I'm going to delete the one. So take
Okay.
yourself off of mute where you have your camera. And I'm going to remove this. I'm going to put it in the waiting room. So now you're only on one. And if you could hit the unmute button, then you can speak from there.
Okay?
There you go.
There you
Thank
go.
you.
Just
You
one of you
fixed me,
now.
and I didn't put you into infinity.
No, thank you.
So,
This is about the best computers have worked for me all day, so I'm really happy. Oh, it's been a day. Okay, honey, you're up.
all right, when I was, I guess, about 39, I was having some palpitations, and which scared me because I have two brothers who have cardiac issues, not HCM. One brother had two triple bypasses, and the other one had they called it a small heart attack in his 30s. So I went to a cardiologist because I really didn't have a GP when I was like 39. You know, I just finished with having children. I only went to my gynecologist, obstetrician. Anyway, I went to this cardiologist who said, I see a little something. He says, but most women don't have cardiac problems. So, but just go get an echo. So he sent me for an echo and they found nothing. Then about a year later, I went to the urgent care to get my, uh, a renewal on why can't I think of this word?
Vaccine?
No, I was just getting my
Oh, medication?
a medication renewed. So I
Okay.
went there and the doctor, when he examined me, said, you know, you have a murmur. He says it's a very specific murmur, and I really think you might have this condition called HCM. He explained it to me, and I was like shocked. I never heard of it. And he said, you should not do anything until you get an echo. So that's where I got diagnosed, was at an urgent care. And
Wow.
then I went to my brother's cardiologist, which at the time was Dr. Schwartz, and he was at St. Luke's Hospital. And so I went to him and he confirmed that I had hypertrophic cardiomyopathy with obstruction. And they were all very excited. They made everybody come in to listen to it. It was very interesting. So he put me on, I believe, verapamil at the time, or metoprolol, or both. I don't remember. And then when he retired and I continued with Dr. Tamas, she was my cardiologist, and she recommended that I go see Dr. Sherrod, who was at St. Luke's at the time, because it was a center of excellence. So that's how I got into see Dr. Sherrod, and then I followed him when he went to New York Langone, and I had a myectomy 2 years ago. But now I'm being seen by in Westchester County at Westchester Medical by Dr. Naidu. So that's my story.
And how did you get from the urgent care to cardiologist? It was your choice to go?
Yes, because, well, he said you really need to go. So I went to who he recommended, which
Okay.
was a local cardiologist, and he confirmed that I had HCM. And
Did you
then,
follow up at all with the local cardiologist after going to a specialist?
no. Then I went to Dr. Schwartz, who, you know, then confirmed it. And it was very interesting because he made me stand up, he made me squat, he was just listening. And that's when he confirmed it without even doing the echo. But one
Well,
thing that I do want to mention is I've had echoes done other than at a center of excellence, and they don't always use the proper technique. And I think that could be an issue, an important issue, because my daughter also, she lives in Jersey, South Jersey. So she had an echo done and they've said, you're fine, you're fine. But then I told her she really needs to go to a center of excellence. And when they changed the protocol, and yes, sure enough, she's got HCM too.
I agree 150%. And HCMA has been working with the American Society of Echocardiography to create better training for
Yeah.
sonographers, and we're on it.
Good.
I
because-
can't say I can solve the problem tomorrow, but we are very well aware,
Yeah.
and we are
Interesting.
trying to do something positive
Because
there.
that really, I think, is an important issue, you know, where you get your testing done.
Yeah.
I completely agree. But for the purpose of this study, we are here to focus on the communication pathway of the docs. You may be invited to a future event on how was that echo, and we can get feedback on that, so that we could do a whole talk show on that.
Yeah.
How bad was that echocardiogram?
Mm.
I actually let the sonographers like practice on me now with the transplanted heart. I'm like, no, you're not doing it right. And if you're going for HCM, you want it right up there. And I play with them and they're like, that was really helpful. You should do that. Like I do it all the time. Anyway. All right. Anything else, Patricia, in your
No,
story?
but I do have to sign off. I have my granddaughter here and
Okay.
I told her 8 o'clock. I'm sorry.
Yeah, I know we're going a little bit later than that because we're only getting through question 1. But you're covering a lot in your story. So for those who can hang on, we can go a little bit later, maybe till 8:30, and we can wrap up the second section a little bit faster than the first. So June, we're going to go off to you now.
Okay, thank you.
Okay, you can hear me.
Okay.
You can hear me okay?
Perfectly.
Yes.
Okay. So my story is long, just like everybody else's. I'm going to try to make this brief. I'm currently 64. I have a whole history, both sides of the family, of people that have had heart attacks, mostly because of diabetes. My brother died at 57 of a heart attack, and my father died at 67 of a heart attack. So I just figured I had a strong family history of heart disease. I was having some exercise intolerance. I was always very physically active, physically fit, doing a lot of hiking and always walking and so forth. And I was in my early 50s and I was struggling walking up a very mild incline with my sister-in-law, who's 10 years older than me. And I got to tell you, I exercise a whole lot more than she does. And she's talking and I'm out of breath going up this hill. And I'm thinking, this isn't right. This isn't right. So the more I thought about it, the more I realized that always hiking, I was the one that slowed the group down. I was the one they had to stop for. I was the one who had to stop and catch my breath. So I mentioned it to my primary. He said, go get a stress test and a chest x-ray. So long and short of it, they did all that and they never said anything for either of those tests. But I continued with a cardiologist. They said you should be, the cardiologist who did the nuclear stress test told me to follow up with a cardiologist. So I followed up with a cardiologist, mentioned all my symptoms. She couldn't find anything. She sent me to pulmonary, blah, blah, blah. I kept saying, look, on a flat surface, I'm fine, but come into a stairwell with me. Come up a hill with me. Come climb a mountain with me. That's where I'm having my trouble. And I was like, not really lightheaded because I would always stop before that. Long story. I was with a pharmaceutical company. I was at a cardiothoracic surgeon's conference. I was one of the vendors and I was walking around on a Sunday and I met Lisa Salzberg, who was standing in front of her cadaver heart. And I'm reading this flag that's on, like, this standing flag, and it said, if you have these, these symptoms, whatever. And I was reading it, and I was like, every one of them except one. And I said to her, my brother died at 57, heart attack. And she looked at me and she said, that's sudden death. And I said, oh. And then I realized, and she looked at me, and I said, well, I've been diagnosed with aseptic septal hypertrophy. And she looked at me and she said, you have HCM. And I just burst into tears. I was like, oh my God. And then, here I'm looking at her cadaver heart thinking, what do you mean here? Whoa, kind of thing. So I had been to, and I'm trying to remember my brother had already died and then I was having some symptoms. And my troponin levels were actually elevated, but I was in a little bit of a stressful situation with work and so forth. So I dismissed it, but I was in the hospital because I had chest pain. So I went to the hospital. I had flown home from Baltimore. My husband brought me to the emergency room and the doctor couldn't even believe he's treating me for indigestion. He's like, you could have bowled me over with a feather. I couldn't, you fit and young and female and your troponin levels are elevated, whoa. So then they did a catheterization and still, I didn't know I had HCM. And now I've read that can be very, very common with HCM is your troponin levels can be, and you're not supposed to give nitroglycerin to a person with HCM either, but I had that and I'll never have that again. So anyway, I've educated myself kind of like, was it Chris, the hockey player who was on earlier talking about, you just have to be an advocate for yourself. You have to educate yourself. But I really feel that they say 80% of what a physician does is a report of the patient. It's not really, the medicine part of it, the art part of it comes with the report from the patient. So if you don't give them the information, and they're not going to be able to help you. So I didn't equate the fact that my father died at 67, his mother died at 54, my grandmother at, congestive heart failure, her father at 60, her brother at 54. I didn't equate that to a heart condition that was more than just, okay, they were smokers, they had diabetes, they were overweight. What's the big deal here? But clearly there's heart disease in my family on both sides. And so my symptoms were not those of a person with diabetes. I didn't have diabetes. I still don't have diabetes. I'm a normal weight. I'm very physically active. I'm physically fit. I walk 4.5 miles every day. I go to the gym and lift weights. I've hiked 46 high peaks in upstate New York. I'm an active person, but nobody was listening to me when I said, I'm having trouble exercising. So anyway, I did end up at a center of excellence because my doctor, I think she was sick of hearing from me. I wasn't taking no for an answer. I was seeking information. I'm still not the way I should be. There's still something more that you can do. So
And what is
anyway,
the highest level of care that you have gotten to? Where do you get your care
I've
today?
gotten to a center. Well, I've been to a center of excellence. Dr. Naidu, who was mentioned earlier, I didn't really have a good, I'm going to say I had a decent experience with him, but I felt that I could also get my care locally from a doctor who was able to prescribe Camzyos, which I'm not currently taking. I may be a candidate for it, but I'm not quite ready to take Camzyos. I'm kind of on the verge. So I felt, why was I driving 5 hours to go see this guy when I didn't feel that he was doing anything more for me than what I could do here locally with someone? I may change my mind on that. I may find somebody else. I'm actually going to Boston to be involved in a study, the Sonata study, if you're familiar. I start tomorrow, actually. There's a doctor there and a couple
Linda
other
and I are
specialists.
working on that one too. So that's yay.
Okay.
2 birds, 1 stone. Thank you.
So I'm going to, right. So I'm going to see if I can learn anything, about my situation. But I just feel my local cardiologist, I'm not saying she missed the boat. She called it asymmetric septal hypertrophy. And it wasn't until I pushed to get an MRI that I learned that. But in the meantime, my kids weren't tested. I didn't know what I had. I was still doing a lot of extreme exercise that I probably shouldn't have been doing, having trouble doing it and wondering what the hell's wrong with me. You know what I'm saying? Like it was, and I knew they were missing something, but once I was diagnosed, then I could kind of, take the responsibility for myself and figure out what I needed to do and where I needed to go and what I wanted to do to control my situation.
So there were actually 4 questions. Oh, I'm sorry. We have one more on the phone.
Yeah,
June,
Justine.
yes. I'm sorry, June, were you wrapped up there? I'm so sorry.
I could talk forever, but yes, I'm done.
I'm sorry. You sounded like you were getting to the end of the point there, and I just jumped on to go to the next.
No,
Okay.
I'm good. I'm good.
Thank you, June. And we'll be talking again tomorrow, I believe, or later this week. Okay. And last but not least on the phones, the most patient man in the room.
Yes, he is.
Okay, so my story is a little different. I came to United States about 40 years ago. So back home in my country, naturally that was not a developed country, so there were no technology or advancement where people can diagnose HCM. So I never heard anyone had that kind of a diagnosis in my friends or the family. So that is the background. Now, my family history is of diabetes. So my mother was diabetic, my father was diabetic, and they got diabetes and they were under the care, but later they also developed cardiac symptoms and heart attack because of the diabetes, and they died of diabetic complications. So back in 1993, when I was about 35 years of age, I went to a primary care doctor here for an annual checkup. His name was Dr. Robert Adair in New Jersey. And he examined me and he said, "You have a heart murmur." So he asked me, "Why you have a heart murmur?" So I was blank because I don't know. He was the first man ever who told me that I have a murmur. So then he asked me a few questions, and then he said, "Oh, you may have a ventricular septal defect or something, but nothing serious. But I just mentioned you." I said, "Fine." So that was my first encounter of my heart problem there. Then moving forward, when I turned 40 years of age, I had series of blood testings, and I was pre-diabetic at that point. And because of the pre-diabetes, I also had high cholesterol, and I had high triglycerides. My triglycerides were running in 500s, and my cholesterol was 250 or something like that. So at that point, when I was about 45 years of age, I saw first time a cardiologist. So that cardiologist, naturally based on my history of diabetes, family history of diabetes, high blood glucose, triglyceridemia, and all those, they focused more on a coronary artery disease rather than HCM. But when I went to this cardiologist, he did echoes, EKGs, and some other tests. So he told me first time that I have, he asked me that you had a heart attack ever? I said, I don't know. I never had chest pain. So he told me that your heart is abnormal somehow because you are having an abnormal EKG. And that EKG is showing that you have a heart attack, or it is similar to those who had heart attacks. So you have a abnormal EKG, and whenever you go next time to the doctor and they want to treat you for the heart attack, you told them that you have no heart attack. This is an abnormal EKG you have because of the heart condition. And I think maybe at that time he said it may be HCM or something, but he didn't do nothing. He just said that you have abnormal heart attack, EKG. Moving forward, when I started going to that cardiologist, he also sent me, I remember, to a nuclear study. And then he told me that he was looking for obstruction, but at that time he said, you have no obstruction. So, but other than that, there was no other treatment. And he didn't ask me to go to HCM specialist or something like that. Moving forward, I was under the care of different cardiologists, and they did focus on my cholesterol, my hyperglycemia. They did catheterization. They say that your arteries are fine. You don't have a coronary artery disease, and you have myopathy of your heart, but you have a symptom. I said, I have no symptom. So he said, okay, but you should come for annual checkups and all those kind of things. And I think during this time, they put me on a beta blocker. And they say that it will help you in filling of your heart, and this is what you need. So that goes forward, and I was 60 years of age, and I have no symptoms. I was doing regular work. I used to work in a clinical lab, so sitting job and moderate activity, not very hard activity or heavy activity. But at that time, I realized that I have a cardiac myopathy, and I have some of the symptoms that occasionally I get short of breath, tired and fatigued. But other than that, there was no arrhythmia, there was no hypertension, there was nothing. Then
let's go back for a couple seconds here. In the terms of the communication, which is really what we're kind of focusing on, is that communication up and back down the stream. The communication between the community cardiologist that has told you that there is as you're referring to it, a myopathy present. Did they give you any indications on where to get support, where to get more information, or they just kind of left you hanging where they were?
No, they did not direct me to any center, any specialist, nothing. And they just advised me to keep coming to them. And I think they did the annual echo.
Did they
And
encourage you
they
to do
also
family
did,
screening and look at your children or siblings?
yeah, they advised me for my children that they may be at risk. So I have 4 kids, so I asked them to go to the cardiologist, pediatric cardiologist, and they went over there. And I don't remember if they had echo or not, but the cardiologist didn't seem worry about it, and they said no, the kids are fine.
Okay.
And my kids are now 18 years of age. I mean, now they are adult in a way, and they have no cardiac symptoms.
And have they been screened?
They have one time screened by the cardiologist, and after that, and this is actually in their history that their father had this issue. But other than that, they go to their doctors, but they are not going to any cardiologist.
Okay. We're going to pivot very quickly. If we can all stick with this for another 15 minutes, I'm going to kind of rephrase the second question. Linda, do you want to read the switching gears component, please?
Sure. So one of the major components of the HCM evaluation and treatment is discussion about screening of family members, including genetic testing for the patient and their families, and clinical testing as well, echo screening and genetic testing for the first degree family members. So should I go, Lisa, or are you going to go? ahead.
Let's pull this all together into a quest. I think we've kind of touched on this throughout some of your stories, and if you've already commented, that's going to be documented in the history. Just kind of the way these questions rolled together. There was actually 4 questions in the first part, and you all kind of hit them in your explanation, so I didn't have to go back around for each one.
Right.
So what we're looking at here is the primary care physician only at this point. So let's just think about that primary care physician in your life. Thinking about your HCM care, how would you describe your experience related to family screening or genetic test recommendations from your primary care? Is this somebody you want that messaging from, or do you want that messaging from a specialist? And if you want like some guidance from them, that's one thing. If you want no guidance from them because you don't feel that it's in their wheelhouse, like, do you want them involved in this decision at all? There's some controversy right now. Where's the line for the GP and the cardiologist? Who should be doing what? Who's got the bandwidth? Who should handle it? So we're kind of curious, like, what do you guys think? Do you want to know about this stuff from your GP's level or not? And then while you're thinking about that question, and we're going to do this one more like in a 1 or 2 minute comment, because I don't think we really need to go much further than that.
Yeah.
Do you want to hear from the GP on HCM family screening and genetic screenings? And if you have, and if you already commented on it, thank you, talk to your family about either clinical or genetic screening. And if you've ever had an experience with a primary care physician ordering any such tests. So A, what's the role of the primary in your mind? B, would you talk to your family about screening? And I think we've already covered that for most. And lastly, if your primary care has provided, how were they dealing with that? So we're going to go back to the top of the rack. Polly, you're up.
My primary, in my case, my primary always knew that we had a family history, but in many cases that's not true. So there'd be no way for them to suggest genetic testing if they didn't know that you had been diagnosed or you had a family history. The only thing that happened in my family, I have 3 children. My son was seeing the same physician that was our family physician. And so when he heard a murmur, he sent my son for an echo, which came back clear at that time. But my son was a teenager at the time. So he should be continued to be followed. When you fix the medical care coverage and the insurance coverage in the United States, then we'll all be able to be properly covered and followed.
Amen.
Here, here.
Yeah, we're trying on that one, and do appreciate that one. So do you feel that your GP would be competent to order a genetic test if you knew your genetic variant?
I think so, but again, he didn't diagnose me. And
Okay.
all right, and our family is one of these many families where there is no known lesion. I've been
Mhm.
tested by my
Okay, so you don't have an identifiable gene.
we don't have an identifiable gene in our case.
Okay. All right. Thank you very much. We'll go to Mimi, then Lawrence.
So I guess you're asking, who do I think should be taking the lead on ordering genetic testing?
Do you think that your primary
Kasim?
Justine, can you put yourself
Yes.
on mute for a second? We're hearing your conversation. Thank you. Mimi, what we're looking at is the role of the GP, the general physician, your community, local doc. Should they be talking to you about screening, or should they be involved in genetic screening?
Well, I don't think so. I mean, okay, I'm just thinking from my point of view, when I was at Mount Sinai, one of the things they did was order genetic testing, and there was a genetic counselor who kind of ordered the tests. And I think that was probably more appropriate because they know what tests to order and how to interpret the results. So, I don't have kids, but I do have siblings. And when I got the results I got, the genetic counselor suggested that I have my siblings also screened. And one of them chose to do it and the other one didn't. But they both had echocardiograms. So I'm not sure how their GP would have been involved in any of that.
Understood. Okay, and you had the conversations with your family. Were there any things that you would like to share about your experience in talking to your family about?
Well, they definitely didn't act on it very quickly. My brother never got a genetic test, even though I told them at the time that I could have 2 first-degree relatives tested for free. And neither one of them took me up on that or followed through on it. Eventually, my sister did get a genetic test and has the same variant of unknown significance that I do. She had an echo and didn't get any, she was screened and they said she was okay, although I'm not sure about that because she is having a lot of symptoms. And so I've
Where
been
was your sister screened with an echo? At a
where?
center, at a community doctor? Where was she?
Community, yeah, yeah. And I know that in my case, the hypertrophy wasn't that much, but I had a lot of problems with my mitral valve. And she's having some of the same symptoms I was having. So it's a little frustrating, but you can only do what you can do. And
Point her
as
in
for
our direction. We'll try to guide her a little bit for you, but yeah.
and as for my brother, he says he's not having symptoms, but he does have he meets the diagnostic criteria. So just because of his septal thickness.
Yeah, swell measurements.
So that was my experience with them. I think that part of the reason I don't know, I think that he has a daughter and he's like somehow worried that somehow it's going to affect her, ability to, I don't know, that he doesn't want her to get diagnosed or something. I mean, it's crazy to me, but he's been dragging me
Real.
feet. So that's my experience. Yeah.
Great.
And I have a brother who died 6 years ago, and I got a hold of his summary of an echocardiogram that was done a few months before he died of an unknown cardiac or cardiovascular event. We never had him, autopsied, but his echo showed focal septal thickness of 1.3 centimeters. So I guess he probably had it too. And he may have died of it, may not have. I don't know.
How old was he?
He was 57 when he died.
Okay. That's interesting. I'm sorry for your loss. It's those mid-50s that we're not quite sure. Does that lead to family risk of sudden death or not because they're over 55 and all the other things that can happen? So we're still learning about
He
that
had a
one.
lot of other risk factors, so who knows?
Who knows? Yeah. All right, Mimi, thank you. Lawrence and LP?
I prefer to defer to the professionals and get that done by the cardiologist. I think, especially with the Center of Excellence that I go to at NYU, they really stay in their wheelhouse. They stay in their lanes, and they're very careful about that. I've had that with other specialists. So that's on that. My brother, when I first joined the HCMA, and I did my onboarding with Linda, I talked about my experience trying to talk to my experience about getting my family on board. Since then, my brother has been diagnosed with obstructive HCM.
I
And
didn't know that. I
I've-
knew he was resisting.
Yes, we need to catch up on a couple of things, Linda.
Yeah.
Offline. It happened within the past 6 months. And we've gotten his kids tested, but he went to his cardiologist at Weill Cornell. The short of the long is his cardiologist, Dr. Massera, was the fellow of his cardiologist at Weill Cornell. And I saw some of his records and I'm like, I don't like the test that you've done. It's not an apples to apples comparison of what the protocol is at NYU. Finally, he was referred to Dr. Massera. It took a while, but he's now on board at Dr. Massera's. And we've gotten his kids tested. Dr. Cheshin saw his kids. So right now he's okay. He's just taking a beta blocker. But it was I was diagnosed at 45. I onboarded with the HCMA about 2 years later. So it's been a process. I even did the family tree. I looked back at everyone. There's heart conditions on both sides. There's sudden death by my grandfather on my maternal side. But even going way, way back, there's heart conditions on both sides. So it's kind of, and I explained this with Dr. Massera and his team. So it's kind of interesting. And I tried to explain this to both my parents. They're in their 80s. They don't have an interest in sharing that information. I'm like, please just give me your latest echocardiogram. They're just not interested in sharing it. So I have to respect their wishes.
Yeah, that generation's a little tough, but they don't want to do it. They're not going to do
Yeah,
it.
they're protective.
Yeah,
Okay.
and
They don't wanna be
they're in their
blamed.
80s. They're in their 80s,
My
right?
mother-
They probably don't want to know anything at that point.
Well, my
do
mother doesn't want to be blamed, and my
Oh,
brother
right.
my brother has not told my parents about his condition. There's some other stuff going on with my mom having a pre-existing condition. She's been battling ovarian cancer for the past 12 years, so she has her hands full.
Yeah.
And I respect that, but yeah, they don't want to deal with another condition and another thing, so we're kind of being sensitive to that.
Yeah.
Understood. All right. Thank you, Lawrence.
Yes.
LP, then Patricia, then Chris, then off to the phones.
So because my brother and my sister were both diagnosed, and I had been going for screenings with a cardiologist, I mean, the cardiologist never mentioned genetic testing. I suppose, like if my GP had, I mean, she sees my whole family, so she's aware of the family history. So, I mean, it would have been nice for somebody to suggest genetic screening, even if it came from my GP, I'm thinking, because it didn't come from the cardiologist either. So, I mean, if somebody would have recommended it, would have been nice, but nobody had suggested that until I was already diagnosed. So, and then, and so they will not, since that time, like I said, several family members have had the genetic testing and been positive, but not positive for the condition itself. They won't screen my kids because my results were uncertain. So my kids are being seen for echoes yearly, but they will not do the genetic testing.
Okay. Obviously the other members of your family, well, if you have a VUS, we really can't test for that, but it sounds like your family is communicating risk and screening, and it's just an open conversation in your family, and it's comfortable enough as a medical condition can be to discuss with family. Would that be fair based on what you've said?
Yes. Yeah, we're open about it. Yeah.
Good. Okay.
Yeah.
That's helpful. Anything else you want to add?
No, I think that's it.
Great. Thank you. Patricia, then Chris.
So, I mean, just my opinion, I think both, not that your GP should order the test, but they should suggest to you, that you should have genetic testing done. I think they should just support, having it done. But of course, I think it should all be done through your cardiologist, because they would have access, I would think, to the genetic professionals that could, interpret the test for you and talk to you about it. But my first cardiologist, the local cardiologist, he actually did suggest it, but it was very early on when I was initially diagnosed. And I was just like, well, I don't have kids. Why would I have that done? Like, I don't need it, but then once I got to the Center of Excellence and was being treated there, that's when I ended up getting the genetic testing and stuff. And my brothers, I told them, you really need to have this done, especially since they found, the marker, and they were both not getting it done. But in their defense, they had jobs that if they were diagnosed with this or found to have this, they probably would have lost their jobs. So, or I don't know how that would work, but they wouldn't be able to do those jobs that they had. But I think between their wives and ex-wives, because they have kids, I have nieces and nephews, and I'm like, well, don't do it for you, do it for your kids. Like, you got to. I even had your book sent to one of my brothers, hoping that if he wouldn't read it, his wife would read it. But eventually they did. It took a couple of years, but eventually they did. And luckily, nothing was found.
Okay, so the conversations were had. The value you see of a GP doing this is
Supportive.
Yeah, supportive, but not the lead.
But not the person.
Perfect. Okay, Chris.
Well, I'll answer the last one first. I don't have children. My sister is not biologically my sister, so there was no need for any genetic testing. I will say, without running the risk of alienating any general practitioner, I'm all about leapfrogging over a general practitioner to a person of excellence or a cardiologist. Absolutely not what I want my general practitioner even involved in that conversation. I don't want to raise any eyebrows. I've just felt that a lot of times the information I have has become so convoluted just about HCM, because people who really don't know the ins and outs of this, and I certainly don't, are the first people to kind of give some information, and it turns out to be information that I might not find reliable. So that's really where I'm looking at that from.
I am not surprised to hear that from you at all, my friend. Not at all. There's always backstories behind me and all of y'all. So Chris and I go way back, and I know how detail oriented he is, and everything has to be 3 citations to prove a fact, and I respect that. But there are some people who really are just like you, Chris. You're not alone out there, just so you know. Although you do have the nickname of Mr. Tenuous, and you are the only one I have with that nickname. Okay, off to the phones. June. Do you think
Sorry about
GP
that.
should
Okay.
be doing genetic testing?
Well, I'm
and-
going to say a primary care should be aware, especially if you're giving your family history. Your family history should send up a red flag. If you have that significant a family history where people are dying of heart attacks, it should raise eyebrows. They should be suspicious. If there's a lot of heart history, then they should refer you to a cardiologist. But a cardiologist is the person who went to college or medical school to learn about heart conditions. They're the ones who should be screening for this. But if you're in a rural area, you may not have a primary care physician. You may not have the opportunity to go to a cardiologist, so they should screen you.
And in terms of communicating with your family, how do you feel their role should be?
I think it's important, but I've heard everybody's story here. I think it really depends on your family. Not every family is transparent. I think there's a huge concern now about insurance. Will insurance take me if they know I have this heart condition? Is this considered a pre-existing condition? Yada, yada, yada. I mean, I think it's bigger than a breadbasket. It's not everybody wants it's Big Brother knowing. It's okay for the family to know, but what about Big Brother? As soon as you put it through the system and the testing is known to the world out there, who knows where that information goes? That's the concern.
I hear you. And we're all living in a little
Personally,
bit of
I'm old enough,
uncertainty.
I don't care. But I think I can understand why people would care.
Yeah, it is interesting, the demographics that we have here. We don't have a lot of early, you know, early adulthood present here. We're all in the thick of it, right? So maybe we need to
Well,
do a focus group on some younger ones too.
right. But
to-
it's hard to, I'll be honest, it's hard to find time in the evening to get on any of, by this time of the day, I'm kind of done. And
Yeah.
this is, a big time commitment. So to capture a young audience, it's probably not going to happen at this time of the day.
No, it probably wouldn't, but they weren't in our group to court anyway. So we've got this far.
Right.
Okay.
Yep.
All right. Thank you so much for that. And last but not least, you're up.
Justine.
Justine, come on.
Okay. So the thing is that my experience about primary care physicians are that if you tell them a problem, they refer you to a cardiologist, for example, and cardiology will deal with it. If you tell them about neurology, they say, go to neurologist, they will deal with it. So I don't know, but this is my experience with my primary care physicians. Now, in my personal case, neither my cardiologist, neither my primary care physician advised me for any testing. Even I went to Dr. Desai and they took a big history and they asked me about the test, but they didn't ask me to take my own genetic testing and all those kind of things. So I am in Rochester, New York, and I read in a paper that there is a doctor in the Rochester General Hospital who started doing genetic testing. So I called that doctor and I am going to see him for the testing next week, Tuesday. So this is my approach. And my goal is that I will go through it to confirm what type of myopathy I have. And if my testing comes positive, I will definitely ask my family members to go for the testing, and for their future family members and generations, they should know that how to deal with their HCM. They should acquire more knowledge about it.
So you had
this is my
nobody
take
ask.
on that.
Oops, sorry about that. So you had nobody really ask you about it. You reached out to somebody who was different.
Correct.
Even. Yeah. Okay.
Correct. I am proactive in that. Nobody asked me to go and do, or they provided any information about it.
I'm surprised because Lisa, I mean, from what I see on the intake part of it anyway, it seems like really, if I had to bet money, when I get to that question, if somebody is at a COE, they've been asked.
There are still some there's some issues with not everybody being asked the same thing in the same way. And it could be your age, it could be your ancestry, it could be
An
that you're
oversight, maybe.
well, it's a lot of times like, okay, well, we know it's HCM, we don't have to worry about it. We're not looking at a mimic, or we're not looking at an amyloid or Fabry's. It's behaving like HCM. Where they tend to get involved with genetic testing later in the diagnosis is if it's not really acting like HCM, if it's acting a little peculiarly, and then they jump to it if somebody's been diagnosed for a long time. In current days, what you tend to see is the newly diagnosed, it's the battery, and then genetic testing is just a tick mark in that. And then, the question to the research is there a role for a GP to be ordering genetic testing in an HCM family, or facilitating any screening, et cetera? And I've got mixed feelings on it myself. And I'm, for the purpose of research, going to keep my opinions to myself tonight because, I got a lot of them. But you've all been fantastic tonight. We thank you for sharing your input. We may send you a follow-up survey. I'm not sure what the protocol allows. if they didn't get enough information out of this, but you all kind of handled all of the questions in your narratives without even being directly asked a prompter on the questions. So you all kind of hit the questions on, how were you referred? How were you seen? How did it go from your perspective? The one question we didn't get to tonight, and if anybody has any thoughts on it, they can drop us an email afterwards because we're all getting tired.
Yeah.
Is there anything in the communications pathway back and forth between physicians that you think can be improved? I know a lot of times the specialists don't write back to the docs in timely fashion. The home doc doesn't always read what is sent by the specialist. Is there a way that we can make it easier for that communication to go both ways, from your specialist to your community doc, from your community doc to your specialist? If you have any ideas on how that system can get better, drop us an email and we'll send it to the researchers. That's the only thing I don't think we really got to in all the listing. All right. If there's anything else you want to share, again, just drop us an email. This part of the project is really focusing on that communication and how are we doing it? How are we going to make it better to get those referrals pipeline faster? So y'all brought up some really great points over an extended period of time of like 25, 30 years, really, if we look at all of
Yeah.
this. We've gotten better. We've got a
Yeah,
lot.
and your
Yeah.
input will be used to generate some of the questions that they'll be interviewing physicians about. So that's pretty cool.
I'm gonna make a
Thank
prediction
you.
that they're gonna take a little white lie. I tell patients all the time what's on the test results. No, they don't. No, they don't. They forget a lot and they
Yeah.
make some judgments. So the team will craft the questions with your input, and we may come back to you for further input at another time. Thanks for sharing your time with us. And we
Welcome.
will be logging you in each for GEM Awards times. Linda and Julie can help you with that. This is a volunteer effort. So you get some, hours in your bling box. So you can earn
Yeah.
some credits as volunteers. So thank you so much.
Thanks, everybody. Take care. Have a good night.
Yeah.
Bye-bye.
Good night,
Thank you.
everyone.
Bye-bye.
Thank you.
Right.
Bye-bye.